Hi, I'm Dr. Nicolai Lennox, and I'd like to talk about headaches. You know, if headaches were simple, there would be a simple solution for them, wouldn't there? But how many remedies are out on the market for headaches? How many treatments, how many headache clinics are there? Those of you who suffer from headaches, you know it can be completely debilitating. I don't get headaches very often, and I just don't know how people tolerate them. So I have a great affection for helping people with headaches. There are a number of different kinds of causes that I like to talk about. One of the simple causes is digestive insufficiency. Now what happens is this. You should be able to digest your food in your stomach and your small intestine, right? And it breaks down food normally. And then that food goes into your liver, and your liver should be able to then excrete its waste material through the liver gallbladder channels into the digestion. All right? So there's another talk on digestion you might want to listen to for some of those details. But here's what will happen. If for some reason your efficiency of your digestive system goes down, what will happen is that the food will be inefficiently broken down and there'll be a lot of extra waste material. So when it then goes to the liver is overloaded. It doesn't know what to do. So when it tries to get rid of its waste into the digestive tract again, it can't do so efficiently. Now, I'm not talking about liver obstruction or liver disease. I'm talking about dysfunction. So when the liver can't get rid of its waste efficiently, properly through the digestive tract, it's going to have to get rid of it some other way. And the way it's going to do that, it's going to dump it into the bloodstream. And so the bloodstream then has to get rid of it somewhere. And what it's going to do is it's going to dilate blood vessels, and it's going to poison you with toxic stuff in your blood. Now, some of you may have had a hangover once or twice in your life, and if you remember, you get this kind of temple headache of throbbing, your eyes get all irritated and itchy, and you're crankier than ever. Well, those are the symptoms, actually, of a liver-induced headache, because the liver was poisoned by the alcohol, and it had to dump its waste material back into the bloodstream, so it had to be processed that way. When that kind of headache happens, the first cervical vertebrae right underneath the head here just locks up and tightens. And a lot of times you'll get people with toxic headaches that start where they experience this sort of locking up right in the back of the neck, and then it comes up, follows this beautiful nerve called the greater occipital nerve, and it goes right to there. Sometimes it'll go on to the temporal area. So that's one cause of headaches that we look at. And so when we see that kind of headache, what we're looking at is the patient, you, eating foods that are not being properly digested? Is there a digestive issue we have to deal with? Are you simply eating foods that are toxic to you, and that's the liver throwing out toxins in that way? So one solution to the headaches is looking at digestive system, evaluating your diet. Certainly manipulation of the neck is that miraculous relief of headaches that we oftentimes experience in chiropractic care. Another thing we might think about is there are certain muscles in the neck that are related to different other organs. For example, there are muscles that pull your shoulders back and down out of your neck. And sometimes, if those muscles are out of balance, you get this sort of chronic upsliding of your shoulders and begin to wear your shoulders as earrings. And that puts a lot of pressure up into the neck. And that's oftentimes related to a blood sugar insufficiency, where because of dietary problems or because of stress or because the organs are slightly undersupported, we might have trouble keeping blood sugar up. And as a result of that, you get a blood sugar headache. It starts here lower in the neck, and it just wears and wears and wears on you. So those are two different kinds of headaches. Others are hormonally induced headaches. Sometimes we have headaches that are induced because the hormones are out of balance, and those are a particular more gnawing and driving kind of headache. And so we then have to look back into the system. Are the hormonal glands balanced? Is the liver being able to process the hormones properly? How are the adrenal glands functioning? Is there a thyroid on balance? Or is there hormones in balance from the testicles and ovaries that are out of balance? And so, again, the different kinds of headaches have to do with the different kinds of systems behind. Sometimes headaches are due as a result of trauma. You know, you could have a post-whiplash injury headache that disrupts the mechanism in the neck so much that unless you begin to reset that mechanism properly, it just continually begins to hurt. Sometimes the jaw is involved. There'll be an imbalance in the muscles of the jaw, which allow the jaw to move in an aberrant fashion, which puts pressure up into the cranium, and that produces headaches. So my job is to look at you and what you bring to me and see where your headache is coming from. Sometimes it's several different kinds of headaches. Sometimes, strangely enough, headaches can be promoted by headache medicine. If you look deep into the symptoms of different headache medications, you'll see that headache is one of the, quote, side effects of some of these medications. So a lot of times people are taking medicine for headaches and it's actually causing their headaches. And that's kind of tragic, but it's also easy to fix. So what I want you to know is when you come to me with headaches, I'm going to be looking at you, what your body's talking about, what it particularly wants as a solution to its form of headache. And again, that might change a little bit because it is a dynamic. And so that's why we have some confidence that most of the time when you have headaches, we'll be able to help you out with that. Thank you.